How's everybody doing today? Welcome to Zoo EDventures. It's so exciting to have you with us one more time. And we've got a pretty cool episode today. We're going to be going to the vet hospital and meeting with Dr. J.B. Minter for a little bit. He's going to take us on a tour of the vet hospital. How exciting! Steve's in front of the camera for your Zoo Adventure today. Leslie's behind.
Hi, everybody.
I remembered your name. I'm just kidding.
Thank you. Thank you.
Hey, I noticed this beautiful rock star parking space here.
Yes.
How come you made us park over there?
Look behind you. The other way. The other.
Oh, of course. Yeah. We're at the vet hospital. I guess they do have to have their special parking place, but you know how those vets can get, right? Oh, jeez! You weren't supposed to be out here yet.
Oh, sorry.
Oh man!
The one, the only.
The one time you're early.
Yeah.
The one time you're
I
early.
That time today. So yeah, I heard that. Yeah, honestly, we have that parking spot available for the vet truck that is over there. We plug it in because it's cool outside.
Yeah.
And that way it can stay warm. We've got drugs and supplies in that truck.
Oh, cool.
So
it's all right.
So it's got a heater. It basically, the inside of that truck is staying warm.
No kidding.
It's got a plug around the corner. But when we're not, we park it here. That way we have quick
You're ready
access.
to go.
Quick access. We get in that truck and get out into the rest of the park.
Well, before we get started on our tour, thank you so much for your time.
Oh,
Everybody, by the way, everybody say hi to Dr. Minter.
Hey everyone, how are y'all doing?
Absolutely. Thank you so much, and thank you for your time.
No worries.
That's pretty important because you do stuff here and out in the zoo itself.
All the time.
That's so cool.
So, for everybody that wants to know, the zoo is over that direction. So we are offset from the zoo
gets a little carried away.
quite a bit. So we're
can't see it.
a little bit far away.
Okay.
But yeah, we do lots and lots of things here in the hospital. Anything that the keepers and the animal care staff can bring to us, we would prefer to do it here. But
sometimes you can't.
Someone's not going to bring a rhino to me. You're not going to walk the elephants down to us.
No.
So when that happens, we've got to pack everything up and we've got to go to them.
That's fair.
And
That
so
makes perfect
we
sense.
have that capability of packing the entire hospital up and taking it out to the
That
park.
is so cool. Maybe one of these days we'll go with them on something. That'd be cool.
Maybe.
But we won't. We won't.
I'll take you, Leslie. I don't know about this guy.
Man! All right, here. You take this. All right, shall we?
Yeah, so let me just give you a
please,
little bit
please.
of a brief tour. So this is the Haynes Veterinary Medical Center.
Okay.
So this place was built in 1988.
88?
So, yeah, so it's a little bit old, but we just had a facelift inside, so we got
Oh,
new
good.
paint, new floors. It looks really nice.
Nice.
Across down the end of the parking lot down there, that is the Schindler Wildlife Rehabilitation Center.
We talked about Allie the Bobcat recently.
Perfect. That is awesome. So all of that stuff happens down there in that building
Cool.
right there. So we've got two separate buildings.
Okay.
We do the collection animals, all the animals that are part of the zoo's collection here. Everything wildlife that comes to us is seen down in that building.
Nice.
That way we can basically be able to create a level of biosecurity.
Oh, because you don't want some of those animals coming from who knows where.
Exactly. Anything those
Okay.
wildlife coming in, there's always potential for disease
Sure,
transmission.
yeah.
So we're going to keep those isolated from the rest of our animals.
Now, do you work with those guys too?
We do it at the end of the day. Typically, we're changing things out. Like, so I go over there with a different pair of shoes and sometimes with a different shirt.
Really? Mm-hmm. Digital friends, would you like to learn a bit more about the Rehabilitation Center one of these days? Give us a comment. Don't just give me a thumbs up or something like that. Give us a comment. Give us a yes. If you'd like for us to maybe do something, and that's something, who knows if we can or not, but if it'd be interesting to you, we might be able to take it to the team and see if it's something we can do. I can't see the thumbs ups and hearts all the time, but if you say yes, then I'll know what you're talking about. Very cool.
So,
All right.
so yeah, so come on inside.
Thank you. This is kind of cool. Oh, I guess I need to get the door for Leslie.
hold the door for her.
Sorry, that was kind of
Trying to ditch
little.
me.
No, I need you.
I know.
So, foyer.
Yeah, this is the entryway. And what you're going to notice here is obviously we're in the middle of a pandemic.
Sure,
Steve.
absolutely.
So we've had to spread everybody out a little bit. You can see the protective curtain that keeps
Alicia over there.
Alicia protected from people talking to her really up close. So you're going to see a few odd things here and
It's
there.
not quite the normal.
It's not quite the normal, but we're close.
Okay.
So again, this is the foyer. Basically, we
Okay.
allow anybody coming into the hospital.
Okay.
This is their first stop. They get to talk to Alicia, and she can help direct where that conversation needs to go.
Gotcha.
It may be from me, but again, they may not be here to see me. They may
Sure.
be here to see Heather. They may be here to see one of the technicians. So again, she can help guide that. Plus, she keeps us in order.
Well, that's kind
yeah,
of,
I mean,
and I
some-
know that's a task.
That's a task in general. It's like almost like she's keeping us in track
There
for
you go.
sure.
I'm
So-
lucky enough to get to work with these guys a lot, so I understand exactly what he's talking about.
So honestly, the big thing, one thing I want to show you here is this room back here. This
Let's see what we got.
This used to be the nursery.
Used to be.
Used to be. So
You don't need that anymore?
So in 1988, when this place was built, there was a lot more hand raising.
Okay.
We did a lot of hand raising at the North Carolina Zoo. Animals were purposefully pulled from their mothers sometimes for hand
Wow,
rearing.
okay.
And the reason for that is because the thought process was that if they're hand raised, they'll be calmer
Okay.
and they'll be better suited for working around humans. But what we didn't know at the time is a lot of those behaviors that they
Right.
learned from their parents weren't being passed down.
Oh, because we don't know how to be a chimp. We don't know how to be a lion
Exactly.
or whatever it is.
So
okay.
chimps were one of the biggest ones we realized.
Oh, was it?
Is that is that chimps that were hand raised when they had the opportunity to be mothers or fathers, they weren't learning
They
those
didn't know how to
behaviors.
be it.
I mean, we had chimps that were holding their babies upside down, leaving them places. So again,
That's intense.
we slowly started to go away from that.
Sure.
We have the capability to do hand raising for maternal neglect. If mom has backed off and no
Okay.
longer wants to do anything, we can help out.
So more of a have-to situation,
Not a
than
want
choice.
to. Yep. So we've kind of backed off of the we want to do all these things,
Okay.
and more only if we have to.
Got you. Alicia, is it okay if we continue?
Yeah, you're fine.
And you said your son watches sometimes? Hi, Alicia's kid.
Asher.
What's his name?
Asher.
Hi, Asher. How cool is that? Well, shout out by your mom. All right, let's see what we got later. Lastly, JP, I recognize there's a bookcase,
There's a bookcase. That bookcase.
and these books are missing.
Yeah, there's no books here. Actually,
No
if you
books.
see each of these are
Yeah.
sections of the zoo.
Oh, not for
Forest
books.
Glade. This is where the gorillas live. Aviary.
Kind of small for a
Aviary.
gorilla.
I know. we don't put the gorilla
Oh,
in
not
there.
the gorillas themselves.
This is the medication pickup section.
No kidding.
So anytime that if we have put a script in,
Okay.
and we're saying, hey, we're going to put your scripts, CCL, cat, chimp, lion.
Nice.
So they have some medications here.
Okay.
This is their pickup.
And a script is a prescription.
A prescription.
Okay.
Yeah. So that prescription keepers can come in, they go
That's
to their
right here.
section, they pick up their drugs,
And they bolt.
and they go out.
I love it.
So,
That's
yeah.
a wonderful little plan there. I
So-
like the elephant is the largest
Yeah,
because
so-
I'm assuming
There's a lot of elephants, and sometimes their stuff
a lot
is
of
pretty
elephants.
bad.
Yeah, sure.
So yeah, it's basically a delivery system.
That is so neat.
So they don't have to walk in the back. They don't
And
have to
find
find
somebody. You guys have done
all
it.
of their stuff. Once we've filled it, you just put it up here.
What a neat plan. I love that. Where are we
So-
going next?
Yeah. So come on down this way.
Thanks.
So again, like I had mentioned, we kind of split everybody up.
Okay.
We're going to talk about necropsy in a minute.
Ooh.
Now, necropsy is
Big
kind of
deal.
it's kind of the animal autopsy
Yeah.
in the world. But we have a contract pathologist. So
Oh,
that
really?
person is she's a boarded pathologist, and her job is to look at animals that have passed away
Okay.
and try to determine why.
Oh,
Not only
okay.
does she look at them what we call grossly.
The body
I
itself?
know. He's like grossly. That's
Okay.
gross. But no, that's looking at it with the naked eye.
Oh, okay.
She will also
so
look
what
at,
you see
yep,
right
that's,
there.
That's the gross picture of what's happening.
Okay.
But she'll also look at them from the microscopic level.
Oh, wow.
So she'll take tissue samples and she'll take them to the vet school and she'll process them there, and then she is able to look at them under a microscope.
Wow.
Mm-hmm.
Neat.
So this is her office, but we've confiscated it because she's not here as frequently as some of the other people. And you will see Dr. Emma Houck
yeah.
is in there. This is the other part of veterinary medicine, sitting at your desk. This is the part where you're writing records. So all morning, Dr. Emma Houck has been out and she's been seeing cases.
Okay.
And now it's time for her to sit down and write all that up.
So you're not always hands-on with the animals. There's a lot of
No.
paperwork that goes on,
There's
too.
a lot of paperwork. For every patient that we see, we have to write a clinical note.
Oh,
So
wow.
there has to be a medical record written every day for every patient that we see.
Gotcha.
So if we see 20 patients, that's 20 records we have to write.
Yeah. And
So-
the keepers are doing one record, and
Yep.
you guys are coming back and doing that anymore.
So Emma's in there, and she is writing all that work up, and so she can go home in a reasonable time today. She's diligently
hours.
working in there and getting all
She's
that
worked
done.
with some of our animal ambassadors.
She
so
has,
it's been
definitely
awesome to have Emma around taking care of those critters. And you've met some of the animal ambassadors before, the animals that we can do more hands-on programs with, some of the programs you might have seen Leslie doing with in zoo classrooms and her sciences and her schools and all the other stuff Leslie does. A lot of those animals are animal ambassadors, and you're going to meet some of those hopefully later on in March. Where are we going next?
We're going to
the library.
Yeah, to the library. You're going to see Courtney.
There's somebody else working, somebody in the library working.
Again, we've spread everybody out due to that COVID pandemic again.
Get out of the way a little bit.
So this is Courtney. She is
I'm
our
going to look at the camera. Oh, there she is.
Yeah.
Look at the camera.
She is our fourth,
She's busy. Well said, Courtney. Well said.
She's our 4th-year clinical veterinary student, so she's probably also working on records. Again,
Actually, research for our presentation.
there you go. She's
So it's not just records that you do here. It's a little bit. It goes beyond just even that paperwork.
It does.
Holy
but
cow.
you can see, Leslie, if you want to peek in there, you will see all of the books
And you use those.
all the time.
No kidding.
So all of these books are related to veterinary medicine and typically zoological stuff.
Some journals too.
Some
huh?
journals. We've got human medicine books in there.
Now, why would you have human medicine?
Well, what's your closest relative?
Chimpanzees and gorillas.
And so we've got, basically,
Oh,
we don't
wow.
have that information out there on chimps and
Sure.
gorillas. We take human medicine.
And it's the close.
That's the closest thing we can do.
Is that fair to say? So house cat, bobcat kind of thing?
Yep. House cat, tiger.
Oh, no kidding.
I mean, just a big version. Now, there are specialized things that you're going to
Sure.
work with when you're dealing with a tiger or a lion, but you're going to take feline medicine.
Yeah.
Because that's where all of that practice and all
Oh,
of that
I would've
expertise has
thought
been
of that.
developed. And we take and extrapolate all of that, and we utilize it for larger cats.
Is there a pairing like that we'd be a little surprised of?
When I look at a rhinoceros,
Okay.
I think big fat unicorn.
Big fat unicorn.
Yep.
It's my kind of friend.
Yep. So
That's awesome.
From a GI perspective, rhinoceros is very similar to a horse.
Is it?
Physiologically, they're very similar to a horse. So a lot of the data that we use for rhinoceroses, we do
Comes from a
extrapolate from
horse.
horses. Now,
That is so
again,
cool.
we have some add-ons that we've
Sure,
added
no,
over the
that's-
course
yep.
of the years of working with rhinoceroses.
The specifics.
We've learned a few things specific about a rhinoceros,
Yeah.
but again, most of the stuff comes from a horse.
How about that, guys? That is so neat. And you're able to kind of take that and learn the stuff that you've already learned
Well-
and build up on that database for the animals that may not.
So the interesting thing, when you go to vet school,
Yep.
we do not learn about elephants or rhinos.
Of course.
We
That makes
learn
sense.
we learn about a lot of the domestics. We learn
Sure.
dogs, cats, horses, cows, goats, sheep, pigs, and chickens. That's kind of what we get.
Okay.
More veterinary schools are starting to talk about your domestic birds, some of your what we call the pocket pets like hamsters and gerbils.
Sure.
Maybe some of the other exotics, fish, are becoming a little bit bigger in the vet school.
In the
medicine.
vet world, really?
And then as you go through your training, you will learn more and more about some of these specialized.
Getting a little more specialized
So
stuff.
if you go into zoo medicine, that's where you get a lot of this other stuff.
Wow, okay.
So we're going to take, this is called clean receiving.
Clean receiving.
Yeah. So this is what, so you can't come in, you're filthy. Leslie, you can come on in if you would like.
Wow.
So this is where our surgical instruments are going to be. You can come on in.
I was just letting
you
her
can truly come.
space
You
wise.
can also come. This is where you're going to find the surgical
Come behind
instruments that
me.
have been cleaned.
Okay.
They've been sterilized, and they're waiting to go into surgery.
So because again, we work with the animal ambassadors, so
Yep.
when we've been doing a program in there, if you've had a surgery, the equipment comes from this room.
This room.
No
so,
kidding.
So basically,
I did
you'll
not know
see
that. That's
they've
neat.
been wrapped up.
Yeah.
They've been they tell you what they are. This is an external fix it or sit.
Of
This
course it
basically-
is.
Yeah, of
I knew
course.
that.
For broken
know
legs
that.
or something along those lines.
Okay.
Tells you when it was sterilized.
Okay.
And these little pieces of tape, that little black lines here,
Yeah.
that tells you that it passed sterilization.
Okay. So it's ready
So
to go.
it goes in here, stays in here until we need it, or until the expiration date on the sterilization, and then we'll re-sterilize
Oh, you would have to re-sterilize it, really? No kidding.
Yep. So we give it a 1-year time mark. If it's not been utilized in 1 year, we'll re-sterilize.
So it really is, and I'm sure we'll talk about this a little bit later on too. It really is like a hospital.
This is exactly like a hospital.
Just like some of you have been to a
Yep.
hospital. It's just that exact same idea.
Yep.
Patients are a little bit
Just-
different. Some of them hairier.
A lot more hairier. And honestly, it's more like being a pediatrician.
Really?
Yeah. Think about it.
What's that?
When you go to the doctor and the
Okay.
doctor says, "Steve, what's wrong?" What do you say?
My knees will really it won't
So-
bend real well.
But you
and-
tell him.
right?
When you bring your child to the pediatrician, what do they say? Ah!
Oh,
They just cry.
You touch it,
they,
they cry.
they really can't tell you
So
exactly
yeah, you
what's
can't.
wrong.
The animals can't tell you.
And the animals can't tell us either.
Wow.
So
Yeah, I
we
wouldn't have thought about
basically
that.
have to take really good history,
Okay.
talk to the animal care staff. Those are the people, those are our contact points. Those are the ones that are going to know the really fine, minor, small details
Absolutely.
that I may never be able to pick up on. Hey, so-and-so hasn't eaten in the last day.
Right.
Or she just looks depressed. Something's wrong. And I have to take that information and go, okay, well,
What does
she's
that
not doing
mean?
right. What does that mean?
Behavior.
What do we want to do next?
Wow, that's so cool. And we've talked about that with our keepers before. We've been lucky enough to meet with them several times.
Oh.
Those observation skills, being able to look down to see that precise differences.
It is so interesting to see some of the minor things they can pick up.
Oh, it is intense.
I mean,
That's why I'm not a
yeah.
keeper anymore. I tried it for a little bit and realized I don't have that keen, especially when it comes to the animals.
Yeah.
Little cotton top tamarins and little tiny animals that I worked with.
Minor details.
Oh, and they're so good at it.
They've got a little bit of a hitch in their get up. Like
Right.
it's a small little, and I'm like, oh, that's crazy.
Right. That is
Okay.
So where are we going? That way?
We're
This way?
gonna,
That
no,
way?
we're going to go into here.
That says surgery, JB.
Yeah. So I'm not going to do anything for you today. I'm not going to surgerize you.
Nervous.
So the instrument,
That's a great word.
I made that word up.
Right now?
Yeah.
I love it.
Come on in here.
So this is surgery.
So this is our
So you
surgery
could do
suite.
surgeries?
I'm going to give you a little bit of a light here.
Whoa.
So this
Wow.
room is the surgery suite.
Okay.
Sterile. Typically before a procedure, if we know we have a surgery, we'll come in here, we'll mop this floor and disinfect
Clean it
again.
that much more, huh?
Yep. But you will see the big things you're going to see in here is you're going to see 2 tables.
I
You're
see.
gonna
Yeah,
see a
this, I
small-
wouldn't fit on that table.
You would not fit on this table. This is a standardized small animal surgery table.
Okay.
You would fit on that table.
Oh my.
Not saying that we need it, but this table will hold up to about 1,500 pounds.
I don't weigh quite that much.
Nope. But that's how much weight we could put on it.
So anything here but maybe one of the large bears or elephants, rhinos?
Everything has been in this room except for elephants, rhinos, and giraffe.
Oh, giraffe, yeah.
Those are the 3 things. Can't get them in the door. But
That makes sense.
I mean, we've had gorillas in here.
You have had?
Yeah, we've had gorillas in here. We have had large antelope. We've had zebra. I don't know if an actual polar bear has been in here, but we've had bear in here before. I don't know about a male polar bear, but we could bring it in here if necessary.
Yeah.
But thinking about a male polar bear, it's just some of the logistics of getting 1,200 pounds
Oh.
into this room. It's a lot of energy and effort. Sometimes it's easier
lot of
just to
people.
go to them.
Now, would you, because you're getting ready to surgerize,
Yeah.
would you do a surgery out in the field? We
have.
didn't prep to have you. Okay.
Yep, and we've done some of
That's
those.
so neat.
Again, think about Cesar 2011.
Oh, the eyes,
He had bilateral cataract surgery.
That's right.
Again, you can't bring him
No.
here. So that was what we call a clean surgery because he was in the elephant barn. We cleaned it. We did the best we could. He then became almost his own surgery area. He's
So
huge.
big.
So he was draped. The entire head and the front end was
Okay.
draped in, and the surgery was done down there.
That is so neat. And then you can do that here at the North Carolina Zoo in a safe space with all the equipment you need.
Yep. All of that right here.
Love it.
So if you look around the periphery of the room, you're going to see lots of little pieces of equipment.
Yep.
Obviously, sometimes doing surgery on something big is relatively easy.
Sure.
But what happens when you've got a thing that's 15 grams, 20 grams, surgery microscope?
That's a surgery microscope,
That's
so
a
you can see
surgical
that much
microscope.
closer.
So you can look down into those, you can really get down to those fine details
Wow.
on really small animals.
Nice. That is so neat.
Over here in this corner, that's a ventilator.
This is a ventilator?
That's a ventilator unit. So when we have patients that we want to mechanically breathe for, this unit will breathe for them. This is a small animal unit. This is for something small. We've got the larger unit
Whoa.
here. So this is obviously for something significantly larger.
Yeah.
Polar bear would go on this.
Okay.
Big, even a lion would probably be
Gorilla,
put on
as you
some
mentioned a second
gorilla.
ago.
This is a combined ventilator and anesthetic unit. So this is our large animal anesthesia unit.
Nice.
Suction for in middle surgery. You hear somebody, I need suction. That's what that
Pull
unit,
some of that liquid
that's what
out.
that unit is for. Behind you, this is radio surgery. So again, if we radio surgery.
Radio?
So if we need to like do an electrocautery or anything like that, that's what that unit
Oh,
is.
that's what's going to be burning and softening. Oh, wow. This is crazy, JB. Dr. Minter, sorry. You've earned doctor. I need to say it once in a while.
Endoscopy.
What is that?
Yep. So this machine, we can pass a tube down your throat.
That's the throat, okay.
Look down in your belly, look in your esophagus. We can, small enough unit, we could pass up your nostril if we wanted to.
Wow.
We could go in the other end if we wanted to.
Well,
look in your large intestine and colon.
It is 10 o'clock-ish, so
We have some rigid units, so basically instead of the flexible endoscope, we have the rigid units. Sometimes if we want to peek inside of a bird, think about a bird does not have an abdominal and a pleural cavity, so there's no diaphragm there.
Okay.
So we can, you just punch a hole, a tiny little hole in there, pass a rigid endoscope in there.
in the body.
In the body, and you can literally look throughout the entire body cavity with an endoscope. So that's this unit right here. And then the
And you can
scopes
see it. That's
and the
crazy.
scopes and everything are in the other room.
Sure. Wow.
So we have over here, we've got induction tanks. So right here, these 2 tanks, if we need to anesthetize something.
Induce
Them,
anesthesia?
yep. So if we want to induce anesthesia in a small box, we can do that.
Why does that say fish?
Because we anesthetize fish too.
You put fish under anesthesia?
So these are what we call the fish anesthetic units.
JV, just let you know, those are called Rubbermaid totes.
Yep. But it's been modified
Oh,
to
wow,
have.
look at that.
So all of this equipment here would be utilized to anesthetize and keep fish under
See,
anesthesia.
and you can put the fish over there. And
Yep.
do the
So
looks.
this would go on top of this platform. Water would be in this platform, and it would be pumped across the gills, and we would put the anesthetic chemical inside of the water, and it would be pumped across their gills and keep them under anesthesia.
So when did you, unfair question, because we didn't talk about this at all, when did you realize you wanted to take care of fish and all these other animals too?
I was going to say fish were not probably hot. Like when I knew I wanted to be a veterinarian when I was about 10.
10 years old. Wow.
Now,
So think guys, think about that.
Now it's funny. It's funny that we've done the Nat Geo Wild Secrets of the Zoo
That
North
was
Carolina.
crazy fun.
Because when I was really small, I thought I wanted to work for National Geographic.
Really?
I used to love to flip through the National Geographic magazines, and I thought when I was really young that the people that were in that magazine worked for National Geographic.
Oh, of course.
That is not the case.
No,
Those
we
people,
found out the case with the Secrets of the Zoo program.
those people are actually being filmed, they're being interviewed from National Geographic,
Yeah.
and they were working off somewhere else.
Right.
And now that I've come full circle, I've
great.
actually been on Nat Geo Wild. So
Yeah, and you did a great job too.
it's been really fun.
How about a little props for Dr. Mentor on being on the show? I know some of you watched it because some of you said you watched it. So, and it was really fun, and
It was
I think
fun.
you guys did a great job. And what you did is you made the zoo and the people real.
Yep.
And that was really cool.
And again, it was a good experience.
It
And
was.
I think
I'm glad you
everybody-
enjoyed it.
I think everybody enjoyed it.
Good.
So, finished surgery.
Finished surgery done.
The animal's been moved back.
Healthy and ready to go.
Recovering somewhere. Now we have all of that dirty stuff in here. What do? We're going to take it to soil to receive.
Well, of course we are. He'll let me walk right into
Yeah,
soil.
don't let you walk right in.
No restrictions
No
there.
restrictions here. Come on in. So,
Thanks, JB.
this room is where we would wash everything up.
Just clean it up and get it
So
ready.
basically, sink, just like you were at home, wash and dry your dishes.
Okay.
We've got what we call an ultrasonic cleaner. That little device right there, we can put our surgical instruments in.
Oh, and that's what'll clean it.
Yep. And you put your instruments in there,
Looks like a fondue pot.
and it shakes them. So all that minute amounts of blood and debris that are in the crevices and creases shakes out and gets cleaned up. The instruments are dried. They get repackaged.
And take it right over there.
Got to be cleaned first.
Wow.
So they go into the autoclave.
So another level of cleaning. So don't stop there.
This will disinfect them. Basically, this thing will pressurize and heat the instruments up and basically give them a nice disinfection.
Wow. So an extra layer. That's so neat.
And then over in this unit,
That's a washer and dryer.
This is a washer and dryer.
Hey!
Whoa.
Even Leslie and I knew that one.
Yeah.
But this unit is called gas sterilizer.
Gas.
So this is steam, this is gas.
Okay.
So that's heat. So it's going to get real hot.
Okay.
So anything that we have that's plastic that may melt
Oh.
can't go in there. So it goes in this unit.
Nice.
And this will provide a level of disinfection and sterilization,
That
but
is
without
nice.
melting it.
So many things to think about. It's plastic. You can't go through the same procedure. So you have to have specific procedures.
Right? Try
Hold on a
again.
second. Be right. So it's really kind of interesting because you have to have specific procedures for even different tools.
Yes.
That's crazy. Awesome.
And we have a lot of different tools.
Oh, I can't even imagine.
So again, when you run the gamut from looking at everything from a 2-gram dart frog all the way up to a 1,200 pound elephant, you've got to have a lot of equipment from that to this and everything in between.
Absolutely. Huh.
So we're going to step back outside.
Oh, outside, and it's like 36 degrees.
Yeah, a little rainy. It's
Well,
fun. It's
hey,
fun.
you gotta love rain. And there's vehicles, so people actually work here. That's kind of nice to see. That's good. Come on down here, Leslie. Did you ever think, Leslie, that this is what we had going on? I mean, it's kind of neat because we get to come and we've been part of some of these. We've been here and seen, but to hear it all and kind of put it all together in one little thing,
Yeah.
really fun. So thank you so much for your
Well,
time.
you're very welcome. So you're going to see a lot of different doors. We've got an isolation suite.
Isolation.
So if for some reason we have an animal that we are concerned about potential diseases.
Oh,
now again,
pandemic.
if we've got like say we've got a snake that has a disease that we're pretty afraid that it might get into the other collection, it can come and stay in here.
We learned, did we learn here that was in bats white nose syndrome?
White nose syndrome.
So if we saw that or something were to happen.
Well, again, if it was
but
wildlife,
over there.
it would be over there. But if it was
Nice.
a collection animal, like if we had a snake come up with recently snake fungal disease,
Oh yeah,
it would go in here.
gotcha,
Yep. We
And
would
then
not
clean
want that in the
afterwards.
collection. We wouldn't even
No.
want it in the hospital. We'd want to bring it in here.
gotcha, and that's all secure and safe and everything.
Secure on a different ventilation unit.
Oh, no kidding.
This unit right
Even
here
on its own,
doesn't even vent with the rest of the hospital.
No
It vents
way.
specifically on its
makes
own.
perfect sense. Perfect sense.
So these two rooms are necropsy.
Necropsy. And you said that was like an animal autopsy.
Yes. Basically, it's a fancy word for an animal autopsy.
Okay.
So, Steve,
Yep.
everything at the North Carolina Zoo that dies, and everything does die here at the North Carolina
Yeah.
Zoo.
I was going to ask Leslie. Let me see if
Go ahead.
let's see if she's got this. Leslie,
What?
interesting question. I left you I left you in the dark for a reason.
Thank you.
What is the mortality rate? What percentage of the animals at the zoo die?
I'm gonna go with 100%, Bob. 100%. 100%.
Really? You think 100%?
Is it up? Is it
you
up on
think,
the board?
You think
Number
every
one?
animal here dies?
Well, yes. Right?
Exactly. Think about it, guys. Every animal has a lifespan. Heck, every tree has a lifespan. So everything has a lifespan. So although the amazing work that JB and his team can do here can help with that, we've learned that a lot of lifespans are extended under human care because of the quality of care that can be provided here. But eventually, everything passes away. And when an animal dies, we have a lot we can still learn from that animal.
That is exactly right, Steve. So, Leslie was 100, right on the top board,
Right,
Leslie.
number one.
Now,
number
see, now
one.
she's going to get a little carried away. I didn't want to give her that much recognition.
So you're right. Everything here has a mortality rate. Everything here is going to die eventually.
Right.
Now, we've got animals that, if compared to their natural counterparts, are living 10, 20 years past that.
Doubling it easy sometimes.
But they're still going to, the body is not designed to live forever.
No.
So we will get those animals. Again, they're eventually going to pass here, and everything comes down to us.
Right.
And we'll do an autopsy or necropsy on them.
And you said we had that lady who does the past, some of the
Dr.
doctor
Bridget
who does some of
Trowan.
the.
She's going to do. A lot of times, whoever's on site, whatever veterinarian's on park, will do the gross portion,
Okay.
but she does all of the histopath.
Wow.
So that's one of her main jobs is to look at all of the things at a microscopic level.
Nice.
Because when I look at something from a gross standpoint, and I'm like, okay, look at this liver. To say it may look normal to me, but at the microscopic level, there
Something's
may
up.
be so many things wrong with it, and I won't be able to pick that up
Not
by
with your-
looking
yeah,
at
not
it.
with your eye.
So at the microscopic level, she can.
Nice. That's awesome.
So all of that stuff will come down here. So peek in here.
Nothing there today.
Nothing in here today.
We'll take that as a good thing.
So got a big table, obviously we
that's
got
where
some
the-
big animals. Some smaller table for some of the smaller critters. In the back, Steve, all of those jars
Right?
have small pieces of individual animals.
Really?
So there's 3 or 4 pieces of liver, 3 or 4 pieces of lung,
All those jars.
kidney. Every jar there has a small bit of piece. Now we
Wow.
keep those tissues for 1 year.
1 year.
Now Dr. Trowan's going to come in. She's going to take a piece of that portion.
Yeah.
And she's going to put it in a bed of wax.
Wax.
It's called paraffin wax.
Oh, paraffin. Sure.
Yeah. So then she's going to take that wax to the vet school, and they've got a special machine called a microtome.
Microtome.
And that microtome is going to cut that
Even smaller?
smaller to down to the level where if I had any hair, I'd pluck it out, and it would be thinner than a piece of hair.
Really? Each slice.
Each slice.
Wow.
So when she puts it on a slide, she can look at it at that microscopic
No
level.
kidding. And see almost. Yeah, that's crazy. Cool.
So, and then the slides we keep forever.
Really? I guess so now it becomes a resource. It becomes something you can go back and
Because
look at.
we have people that reach out to us and say, "Hey, we know so and so that animal died 5 years ago. Do you have any tissues? Do you have any paraffin block slides, or do you have the slide itself?"
Wow.
And sometimes, again, we only keep the tissues for a year, but everything else we keep indefinitely.
Is there a lot of sharing that goes along in the zoo community?
Tons of sharing.
Really?
Because again, we are all working for the same reasons. We are here for the welfare of the animals. So if somebody at another zoo learns something that's going to benefit me,
Yeah.
they're going to want to share that information
Sure.
with me. So we are very good about sharing all the information that we get.
I love it.
And the medical record system that just came out probably about 10 years ago
Yeah.
has allowed that to push forward even more.
Share and share and
because
share.
all you got to do is set something in the computer and they can share everything with it.
Love it.
Now,
Is that it? No?
no,
What?
I get this question all the time.
Right.
Well, after you do the necropsy, what happens to everything else?
Oh, sure. Do you know?
Because you can see those jars, they're tiny.
yeah, there's not,
There's-
I don't see an elephant back there.
There's no elephant in all of one of those things. So there's pieces and parts that are left.
Sure.
A lot of our animals have CITES permits associated with
And
them.
that's that regulating how they can go, where they can go.
Yep. So basically what you can do with it.
Sure.
Like what can you do with the pieces and parts?
Real quick, it's one of the things, because you guys are awesome about letting us know when an animal passes away.
Yep.
If we would like to have a skull,
Yep.
we would like to have a piece of the hide. You guys are great at sharing that with us, but not every animal you can do that with. Is that kind of what this site is?
Well, for you guys, because you're part of the zoo, you can pretty much have any pieces and
Oh,
parts
okay.
you want. But I can't just discard.
You couldn't give it to
easily.
me.
I
You
couldn't
could give it to
you.
the zoo.
I can give it to the zoo, not to you.
Gotcha.
But other zoos again ask for a piece. Like we have for an example, we have institutions that are looking for. Oh, we want the limb of a baboon because we're doing biomechanics of baboons.
Sure.
So they may want the pieces and parts. So if
see how it all works.
they have to submit a research proposal
Oh, wow.
that has to be approved. If it is a CITES permit animal, they have to get all the approval
wow,
and
that's
permission
so
to have
cool.
all that stuff, and we'll save it and send it to them. Everything else though,
Right? Yeah, I guess it's got it.
we still have some pieces. We still have some leftovers. Is incinerated, and that big monstrosity in the back is our incinerator.
That big gray thing?
That big gray thing is our incinerator. So we will dispose of the rest of the animal carcass by incinerating it.
Which, I mean, it makes perfect sense because now it's gone.
Yep,
You
it's
know,
gone.
if it was part of those something that can't be traded in, there's no way that it can disappear and go and end up in somebody else's.
Yeah, there's no way for it to go into another pathway, and again, especially if that pathway has dark intentions.
Yeah, absolutely. No, I think that's a fair thing to say.
Now,
And you think, oh, I'm sorry, go ahead.
no, so it doesn't burn down to nothing.
Right.
Big pile of ash. Have you done anything on the compost?
Let's ask them. Have we done anything on compost? Leslie, have we done anything on compost?
Just a couple of things.
Let's see. We
love
did an episode on compost,
Yeah.
so that was kind of cool. And we did a food cycle
Yeah.
where we took compost and then they grew food, they fed food out, the animals pooped the food out, keepers picked it up, took it to compost. So it's a big cycle. Absolutely, we do compost stuff.
So the ash all goes in the compost.
Now that's something, Leslie, that we need to think about, and we need to make sure people are aware of that. That's really amazing. I did not know that.
So the temperature in that incinerator gets hot enough that it would burn viruses, bacteria, prions, all of those things that would be we'd be concerned about passing, like any infection. Gone.
Just gone.
So ash is left.
So it's clean.
Yep,
I mean, for lack
clean.
of a better word.
And the ash is compostable, so we take all that ash to
It goes
compost.
to compost. My goodness.
Yeah.
My goodness. And we get cremated. Right?
Yeah.
It's just another way that that's almost a respectful thing,
Yeah.
right? We don't want those parts and pieces to end up in the dark path, as
Yeah.
you said, and then it comes back to the zoo.
Yeah.
It stays in that compost, becomes part of that cycle as well.
It becomes part of that cycle, and again, that
love it.
compost is then utilized in the park, and again, it follows the life cycle that it would have out in the wild.
I love it.
Because in the wild, if something passed away,
Sure.
again, it just becomes part of the cycle.
Yeah, the decomposers, the vultures, all those
Yep.
animals are going to be
Yep.
munching it. All right, how's that? So what's next?
We're going back inside.
Going back inside?
Yeah, because I can see you're like, oh,
It's a little chilly.
out here.
Jeez, a little bit.
So we're going to go back inside.
All right, let's see what we got. How much fun is this?
Sorry, you're really close.
We're going back in soiled receiving.
We're going back into soil receiving.
Again, I get to go first because it's soiled and receiving.
Because it's soil.
Most soiled, I went at last because I'm the least soiled.
Okay.
Again, this was the cleaning. This was the room that got the stuff
Actually,
getting
I
cleaned
wanted to
in.
show you this too. This is pretty. So, storage.
Whoa!
JV, don't go too far over here. Please show us the storage.
So this room is where we keep a lot of the dart guns.
Oh, wow.
So each one of these things has, if you've seen Secrets of the Zoo North Carolina, and you've seen where we've had to sometimes use dart guns to
the oryx.
get the anesthetics to the animal, all of these are dart guns.
Okay.
And then back here in this big monstrosity of a safe,
Get out of the way.
this is where we keep all of our drugs.
Oh, really?
So all the controlled drugs are locked in this. This is
it's good. It's closed.
It's closed. It's a class 4 safe. This thing weighs 1,000 pounds.
1,000 pounds.
I've jokingly said that they built the hospital around it. They put it in here and then just built the walls around it because it's a beast.
It isn't going anywhere.
It's not going anywhere.
Somebody's got some pretty good aim on this. I see some practice on this. They've done pretty well here.
Yeah, we practice all the time.
That's so cool.
So we're always out there practicing shooting the dart guns and making sure
Wow,
that we can hit
look at
spots. You've probably actually done
I have. Yes,
elephant
we
collar.
have.
So this is the Africa. This is basically all this stuff is for our trip to Africa.
That's a whole other episode. I think that's going to be amazing one of these days.
So radio telemetry collar. We got some stuff. Cell phones.
Well, of course.
Some different dart systems. Satellite phone.
Right.
This is all the stuff we use when we go out to West Africa.
That is so cool. I mean, this is. We kind of tease about storage, but it's kind of an important room. All right.
Okay.
Where to next?
We're gonna walk
Yeah,
down the
what?
hallway.
Wow, it's been so much stuff.
Let me cut some lights off and
got-
shut some drawers.
We've been doing electricity,
I
energy
know.
savings, sustainability.
I was saying that too, like when we were talking about cleaning all this, all this equipment that we have to use, but we
Yeah.
clean most of it and
Because it-
reuse it and all those types of things. So
Great point.
So this is the Hall of Offices.
The Hall of Offices.
Yep, so this
it's
is-
not quite as cool as the Hall of Justice, but it's nice.
it's not. So this is my office.
I'm glad that you're available.
Yep, because of the pandemic, we oftentimes have our door shut.
Oh,
So this lets people know
okay.
that you can come in, knock on the door, you can talk to me.
I'm not doing that in my office.
Aw.
I'm keeping it
see?
shut.
And when I want unavailable, I can let people know that hey, I'm busy.
I love
right
it.
now.
Pandemic has thrown some curves, hasn't it?
Restroom, if anybody has to use the restroom.
Let's see, we're not going potty yet.
This is a big stop for anytime I'm giving a tour to anyone. It's the wall of legs.
It's a bunch of legs.
It is a
JB.
bunch of legs.
And
So
feet.
those biospecimens that you were talking
Oh,
about
sure, yep.
earlier, these are interesting for people to look at, but we also utilize these things.
Really?
Because I may say, I need to do something with a joint. What do you think this is, by the way?
Oh, that has got to be. I don't know, Leslie. Do you think giraffe, maybe?
I would say that, yeah. I mean, there's one that's taller, but it has extra bone, right? The next one.
No, so this is the front leg, and this is the back leg of a giraffe.
That is giraffe.
Yep.
So and they know how tall I am. I'm 6'3".
Yep.
Look at that.
Pretty amazing.
So, yep. So this is the shoulder. This is what we call the humerus, or this arm right here. This is a fused radius and ulna.
Yep.
This is these bones. And then from here down,
They should know.
this is his hand.
You should know.
And you can see these animals are what we call digigrade. So they stand on their fingertips.
Right.
So that right there, that is the tip of their fingers. And they're standing on their fingers. Oh, actually, it's these two. And they're standing like this.
Well, I'm glad you told everybody that because I bet they didn't believe me because we did an episode on locomotion and it was a zebra.
Yeah.
They have on a single
one.
toe. See?
He's not making it up.
Not all of it. I mean, not that. I mean, what else are you talking about?
But from a giraffe all the way down to a little Thompson gazelle.
That's a Tommy.
Yep.
So cute.
So we have those out on the Watani grasslands.
Yeah, we do.
The little guys. And all of these animals at one point were
Here.
animals here at the North Carolina Zoo.
And they live on in an educational way, being able to share those
Well,
kind of information.
actually, I've utilized these where we had somebody, we were going to tap a joint. We were going to stick a needle into a joint to see if there was any infection in there.
Okay.
And we brought these out, and I was looking, okay, well, this is how these bones are laid out. This is where I'm going to want to stick the
Wow.
needle. So we still utilize these things as
Even in the vet world.
as education for us.
Neat. All right.
So we'll keep coming down the hallway.
We're going to have to make this 2 episodes, JB. This is continued. I love this. This is
Yeah,
great.
I can get long-winded. I'm sorry.
No. It's good stuff.
So currently, we do not have an associate veterinarian.
Oh, we have.
So Dr. Katie Duck has moved on. She's at the Brookfield Zoo.
Yeah, we miss you, Katie.
She's taken on a staff veterinarian position. So
Oh,
if anybody wants a job, we're currently looking for a veterinarian.
You have your name right here,
there.
right down the hall from JV.
You can work with a superstar.
Next door, you're going to see Miss Heather Scott.
Is this the superstar you're talking about,
she's a
Leslie?
Yes,
Yeah,
yes.
she's
This is
Not JB.
not JV.
Yeah,
But Heather.
she's much more of a superstar than me.
Thank you very much, Heather. We appreciate that.
Besides Alicia, Heather also keeps me in line. Keeps me on track.
Ah, I see
I
that.
run the show. That's how this works. I actually run the hospital.
If you did, you can't hear Heather.
That's what I got from the show.
Say that again, Heather.
I actually run the hospital.
But that's the way the team works, right? It's fun. It's everybody working together, as you said earlier so well, for the animals.
Yep, we're all. That's what we're
Ultimately,
here
the
for.
team is here, but everybody has that same goal to make sure that we're functioning well to take care of them.
Yep.
I love it.
Speaking of which, Doctor, you're at 2:30, so you probably need to stop being so long-winded.
It's not me. It's him.
How'd that
I don't
happen?
believe that.
Didn't
at
you
all.
just say a second ago?
No, I definitely didn't say that. He's definitely Steve. So we're gonna go here.
Yes.
This is really cool.
This is history.
So this is history right here.
It really-
This
that's
is
cool.
Jim Wright. So all these pictures in here, these are
Jim
pictures of Jim Wright.
Right. Jim Wright.
And Jim was the first veterinarian for the North Carolina Zoo.
Oh, really?
Everybody. So when the zoo first started, Jim was working at the vet school. That's in Raleigh, North Carolina. It's right up the street. And he was a boarded pathologist working for the vet school. But he also worked. These pictures that you see, that's
he's
Jim.
holding the bear.
Yeah, that's Jim at the North Carolina or North National Zoo.
Right, rewind.
This is Jim working at the National Zoo. I always like to look at him because Jim is always wearing a tie.
Oh, he sure is.
Everywhere he's at, he's coming out and see. Look at that truck. That's an old Army truck.
That's what he had.
Yeah.
That's what we had.
Well, that's where he had that's at the National Zoo.
Right.
So, obviously, Jim passed away.
Sure.
And when Jim passed away, all of this was up in his attic.
It was in his attic.
All was in his attic, and his son donated it to Mike Loomis, who was the first
God.
full-time veterinarian at the North Carolina Zoo.
I did not know that.
Jim
Dr.
was
Loomis
not.
first.
Jim was not the first. He did not work full time. He was
No
contract.
kidding.
He'd come out when their things were sick.
When they needed something.
But Mike Loomis was the first full-time veterinarian,
Did not know that.
and he donated all this stuff to Mike. And then Mike had this cabinet built, and we were able to put it
Oh,
together.
that is so nice. The love that history and how far back it can go.
Really cool thing is
Yep.
that Jim, along with the gentleman in that picture right there, who is Red Palmer, helped develop one of the first capture dart systems. Some of these guns.
One
in
of the
here-
first ones, period?
Yeah. So some of these models in here, these rifles, are some of the first renditions of dart guns.
I did not know that either.
So-
that is really cool.
Yeah, Red Palmer designed it. Jim helped modify it and make it a little bit better. Went over some of these letters. These are letters between Jim and Red when he went over to Senegal to dart animals for the first time.
Wow.
The first animal that was ever.
I just can't even think.
I know.
The first time that
That-
you go out with this tool
Yeah.
to anesthetize an
It's in a foreign. It's in
It's in
Africa.
Senegal.
Yeah. So there's some really cool stuff in here, and again, I'm really excited to have this stuff here because again, this is right here is the first stage of the advancement of zoological medicine.
And just in general.
In general.
And it happened with the team here.
Yep.
Or some of the team here at that time.
Yeah. So there's some really cool stuff.
Wow. That is so cool. We've got more to do.
We do.
Well, let's give these guys a break.
Okay.
Can you guys tune in again on Wednesday to continue this tour?
Please do. I got so much more to say, and I'll try to keep him a little bit less. So.
It's always, I try and I try, but
But it's always a but.
it is. Thank you so much, Dr.
You're very
Mentor,
welcome.
for this. Leslie, thank you as well for today. I know it's been kind of one of those crazy days for everybody. And thank you guys for tuning in. I know it was a little long, but I hope you stuck around and enjoyed it. And we're going to do this again on Wednesday. We haven't even gotten to the active part.
Nope, that's
this
coming
is
up.
kind of what happens. So tune in again on Wednesday for your Zoo Adventures team. Today it was Steve in front of the camera. Leslie's behind.
Hey, everybody.
We'll see if Leslie will talk a little bit more next time. She was so focused on getting just that perfect shot of our superstars,
She was
JV.
super intent all day. She was,
Yes.
you could
I'm
see
gonna
like
get
laser
this.
beam focus. Laser beam focus.
Good deal. All right, guys, y'all stay safe. Remember, the zoo is open Time tickets, reservations, make them online when you get a chance. And remember, when you come, we're asking you to please wear a mask. We'll see you Wednesday. Bye, y'all.
See you later.